Hi, my name's Natalie Sykes. My student number is 801-654-37. My place of work is Queen Myn Veterinary Hospital and my supervisor is Nia Stamatis. Today we're going to be looking at our patient Tig. Tig is a 7-year-old Bull Mastiff cross. He's a fairly quiet dog, but sometimes, gets a bit excited when you go into his cage. So we're just going to be following some protocol. We'll perform a basic assessment and we'll get him ready for some general anaesthetic so that he can go in for his dental. So what we're going to do in approaching Tig is we've got this slip lead made up. It's basically just a normal lead with a little loop at the end. So I might walk in, put the camera down, and then I'll so that you can see me capture Tig and do a basic assessment. So we'll just enter, with a bit of caution, make sure that Tig doesn't escape. Hi Tig. Hi. So he's just a bit excited. We'll shut the gate behind us. We might just pop this camera down here. We're very lucky with Tig. He's a very good boy. So what we're going to do is just get this slip lead. Tig's having a good smell of me, so we'll get down to his level, give him a pat, and then we might just pop a slip lead over his head so that secures him nice and tightly. I'm just getting my notes out so that I can make sure I remember to do everything. So what we're going to do with Tig today is demonstrate how we can restrain him for the vet to put a catheter in his arm to put him under general anaesthetic, and I will, as the nurse, do a basic assessment on Tig. So Tig, come back here. Sit down. So sit. So as I said, Tig's a very good boy, and some patients won't be this willing, but he's very good. So we've got Tig captured. Now if we were going, we could put him on a table, and in that case, you'd need to really get around him to make sure that he doesn't fall off the table and injure himself. But because I'm going to demonstrate this in the cage, what we'd normally do is sort of get behind him, just make sure he's nice and safe. We're going to lift up one arm and lock in the elbow and turn it around so that vein is nice and prominent so that the vet can get a catheter in there. Also, we want to get Tig's head and pull it away from the vet so that he can't turn around and bite the vet when, she's trying to put the catheter in. Good boy. He doesn't really know what's going on. Okay. The other things that we want to check, we want to use our stethoscope to check his heart rate for about 15 seconds, and then we'll times that by 4. So just on the left hand side here, pop these in. So got a nice strong beat there. I didn't actually bring a stopwatch, but what you do is count how many times it beats for 15 seconds and then times it by 4, and that's your heart rate. During surgery, you also usually have the pulse oximeter on the tongue of the dog, and that will measure the oxygen levels in the blood at the time. So that's another vital sign. I have brought my thermometer along, and what we'd usually do to do a basic assessment of Tig is use a thermometer like this with a bit of lube on the end. We'd restrain him so that, turn him around, hold his head away, maybe get someone to hold under his abdomen here so he doesn't sit down, and we pop the tail up and just put the thermometer in up just the tip of the thermometer to the silver part and wait for that to beep and get a good reading there. You can also pop a bit of lube on the end if you need to. The other thing that we want to do, because Tig's in for a dental, we've already confirmed that he's got a bit of dental disease, so we can just see a bit of tartar and a bit of evidence of gingivitis. But what I wanted to show you as well is the mucous membranes. So they're nice and pink at the moment, nice and pale pink, and if we push down on that, he's got a capillary refill time of under 2 seconds, which is really healthy for a dog of his age and any sort of patients. When he gets knocked out, obviously when we've lifted that arm, locked the elbow, pulled the vein around, and he's catheterized, Once he's knocked out, what we'll be looking for is eye reflexes and also jaw tone. So making sure that jaw is nice and loose and not sort of trying to bite down. So that's a basic restrain and assessment of a dog. Very lucky with our patient today, Tig, because he's very relaxed. Sometimes they're a lot harder, but you know, if in doubt, you can always get another person to assist you. Thank you.